The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Welcome to Mindful Moments, where we slow down and have honest conversations about healthcare, leadership, purpose, and the human experience behind the profession. Today's guest is someone whose journey reflects resilience, reinvention, and quiet leadership through some of healthcare's most defining moments. From immigrant nurse to leading one of the country's busiest trauma centers during COVID-19, to helping shape the future of healthcare innovation and the nurse practitioner workforce. His story invites a deeper question we don't often pause to ask: who we are beyond the scrubs. A journey from bedside nursing to healthcare innovation. And since June is Men's Mental Health Awareness Month, we're holding a space for an honest conversation about pressure, emotional well-being, and what it means to carry responsibility in silence. Today, we are joined by Dr. Joseph de Veyra, a first-generation immigrant nurse whose career has spanned bedside care, executive leadership, and healthcare innovation. He served as a co-founder of Carexa, which focused on improving workflows, reducing burnout, and strengthening healthcare systems through thoughtful innovation. But beyond the titles and achievements, this conversation is really about identity, growth, mental health, and what it means to evolve without losing yourself along the way. Dr. de Veyra, thank you so much for being here on this platform of our podcast.
Thank you so much, Dr. Morante. It's an honor to be in this platform.
Thank you. And I know you have a busy schedule, but thank you for making time for this podcast. And before the leadership roles and healthcare innovations, there was simply a young immigrant nurse trying to find his place. What do you remember most about your early journey coming from the Philippines? And what sacrifices do immigrant healthcare workers carry that people may not always see?
I think one of the key things that I remember was the importance of really starting from the bottom. I started as a caregiver, as a first generation immigrant. And before actually partaking into the RN role, I became a CNA, LVN, and eventually becoming an RN. So I really climbed the ladder of nursing in order to have empathy for all the roles as I became an ACNO. With regard to sacrifices, I know I'm getting emotional. I didn't expect this, but one of the key things that I want to emphasize is that you really have to leave everything behind when you transfer to the United States. All your friends, your family, in order to provide a better life for my mom and my family back home. So I think that was incredibly difficult. And aside from that, you have to shift your goals, because initially when I was in the Philippines, my goal was to become an entrepreneur right off the bat. But as you know, when you transition, you need to find ways on how you can start your life in another country. And the good news is, for Filipinos, nursing is an economic mobility engine. Aside from maximizing your scale of impact as an individual and as a leader, you are also able to provide for your family. So for me, it was such a blessing to have the chance to immigrate to the United States.
And would you say that it was a fruitful sacrifice to move here to the United States, coming from the Philippines and immigrating here with a good representation and credibility that you have right now?
Absolutely, absolutely. Without without immigrating to the United States and without becoming a nurse, I wouldn't have been able to not only serve a couple of roles. Aside from being an ACNO, I was also the executive director for the Medicare Quality Improvement Organization for California, wherein I had oversight over the quality metrics of more than 300 hospitals and around 2,000 clinics. So this opportunity to be in the United States and practice during one of the most exciting times in healthcare and technology was truly a blessing.
Thank you for that. And you mentioned about being a nurse entrepreneur. At some point of your career, or many healthcare professionals begin asking deeper questions about identity beyond clinical roles. What helped you to expand your vision and made you realize that your impact could extend beyond direct patient care?
I think it really started even when I was a caregiver. I would jot down the vitals of my patients, write it on a piece of paper, and put it in my pocket, and I would lose it. I would lose it, or even worse, forget about it as well. So having that humility, I was saying like there's gotta be a better way to record these vitals, and it's called vital for a reason. So there is simply no margin for error for patients when it comes to monitoring this metric. And aside from that early thought, I also conducted my doctorate project in California State University in readmission reduction, wherein I optimized the clinical workflow between an emergency department and a post-acute care setting through a lanyard badge by communicating pertinent clinical information. And it was very manual in nature. And when I was going through that exercise, that project actually became a Medicare Special Innovation Project. But at the back of my head, why are we manually faxing this information or printing this information from one setting to another? And from there, once I also conducted a literature review during my MPH from Harvard University, and what I found was the key way to reduce preventable hospitalizations was through remote patient monitoring. And aside from that, it was very thought provoking for me, because aside from improving patient outcomes, it also maximizes the scale of impact of your staff, because now they don't have to call. The information just flows through their EHR, and they're able to not only be notified but execute early intervention. So instead of the patient being hospitalized, they can actually arrange a cardiology visit when the patient has elevated blood pressure. So by having those simple steps, we're able to improve the healthcare ecosystem as a whole.
I like your vision about making things smoother. And as a nurse, burnout syndrome can happen if there's no smooth workflow, or there's no smooth transition between hospital and skilled nursing facility, which we can better the care by the innovations that you're offering. So thank you for that. And I think you're thinking outside the box, right? Gone were the traditions that we're doing it manually, and now here's the solution for every problem that we're facing right now, especially with helping the nurses achieve a better outcomes for our patients.
Yes, exactly.
Great work, and you helped led one of the country's busiest trauma centers through one of the hardest moments in modern healthcare. What was emotionally hardest for you about leading during COVID-19 and pandemic?
Yes, I think you hit it right on the nail, the burnout, because the staff were getting sick, were understaffed on a daily basis. We had to conduct crisis interventions through staffing during that time. But what I found was building that community with nurses by having executive rounding during the hardest times. And we would actually, along with my other executive leaders, we would actually round even during at night or the weekend to ensure that the staff were well supported. And one of the most difficult parts was learning about that our morgue was full just because of the level the level of carnage that COVID has brought upon us. And it's also important to note that Seattle was ground zero for COVID-19.
Mm.
And we really didn't know what was going on. But the good news is, as a nurse, you go back to your basics: hand washing, hand hygiene, infection prevention. I knew that our training as nurses was evidence-based practice, and I leaned upon that. And in fact, it was actually the key intervention to decreasing COVID-19 rates. And thankfully, at the end of COVID-19, we were able to achieve magnet designation for the first time during the pandemic, and also successfully transition from Cerner to Epic. So it, although at that time it was very difficult, but I'm glad that we emerged as a community. And how did we do that? We actually started the Nurse of the Year through meaningful recognition programs, and we also maximize the scope of practice of our staff by enabling them to transition from one unit to another during the pandemic. So, for example, ambulatory nurses, through an evidence-based nurse extender program, we were able to have them work shifts in med surge units, with the support of clinical nurse educators. So not only were we able to support staffing, but what we've learned is, nurses who transition from another part of the hospital would go back to their old units, and it was like a reunion with friends. So it was just good vibes, all around. So if there's something that you'll know about me, I'm very easygoing, and I'm all about creating positive vibes, in my departments.
Thank you so much for that. And I feel like your positive vibes can actually empower your staff, because gone were the days wherein staff are motivated by threats or by the use of executive power to scare them or make sure that the executives or the admins are looked upon as superior and the staff nurses are inferior to them. So now you're cultivating uh, a culture wherein the nurses are cultivating the young other than nurses eating their young, right?
Yes, yes. Because at the end of the day, it's a partnership. And regardless whether you're CNO, director, you can only truly lead through transformational leadership by capturing their belief, and for them to understand the why. So let me give you an example. So when you're leading a level one trauma center, you would be an administrator on call, and you would execute these transitions between your units and discharges. And sometimes as a nurse, you would advocate for your patient to not be discharged because they're not ready yet, but we're at 120% capacity at the ED. So for me, communication is key. So whenever I was facing any sort of resistance, I would put myself in their shoes and try to communicate my message, the why. So in that situation, what I told them was, I understand that the patient may not be ready to be discharged, but it is about proper reallocation of resources. Although your patient may still be sick, there are a lot sicker patients in the ED who are waiting for that bed. So if we delay this discharge, we're actually not fulfilling our mission as the only level one trauma center in 4 states. And when you actually meet them where they're at, and communicate the message through them as a nurse, then now you lower the resistance, and you're able to work as a team. But it's also important to hear them out and their concerns, provide that psychological safety for collaboration.
And empathy can go a long way. Well said on your collaboration. We really need that, right? There's no I in team, right? Together, everyone achieves more, as my mnemonics for team. And thank you for emphasizing that. And I hope all the leaders and all the staff nurses are listening right now, because there's always a fine tune between collaboration and not competing with each other. Because at the end of the day, we're working with the patient and not just us working for the patient, right?
Mhm.
Now, since June is Men's Mental Health Awareness Month, I also would like to talk about something that doesn't get enough space in healthcare conversations. What issues in men's mental health care do you think people often overlook?
I think the willingness to be vulnerable in front of your teams. Obviously, there's a lot. There's It's deep embedded in our culture to not show that. But what I found with my teams is that by actually showing vulnerability and being forthcoming in the challenges that you're facing, you're actually able to foster trust. And especially sometimes leadership can be hella difficult, so you also need to find ways to fill your cup. And in my case, obviously, you can eat good Filipino food. In Seattle, there's a restaurant called Musang, who is led by a very talented chef. But also find ways on how to decompress. And so I try to run at least 1 to 2 miles a day to decompress and also reflect.
I know that leaders like you and men in healthcare are not given enough space to express emotional exhaustion. So, personally, how do you prioritize and take care of your mental health? I know that you mentioned about running. Are there any specific things, food, and everything like that, that makes you feel good about yourself?
Sisig, no, just joking. For Sisig is a very yummy Filipino dish, but I think honestly having sometimes taking it slow as well. Sometimes you don't have to go 100 miles per hour. Sometimes by having that, by pausing, actually that's very important. Taking that time off, taking that day off or that weekend is very important. I know it's very, especially in this day and age of having the phone, you're an administrator on call. I think that's something that we really need to foster, having that time to fill your cup and also rest. Because if you're not your best self, how can you serve your staff and patients? So it's actually for the greater good of the mission for you to get adequate rest and have that time off.
Yes, rest and resistance is really important for us as healthcare workers too. And I just want to piggyback about the importance also of nutrition. So they have found out that our immunity is also correlated with our gut system, right? So there's like lymphoid tissue in our stomach that helps out with immunity. So the prebiotics and probiotics are needed, and they found out that a lot of our patients are lacking those prebiotics and probiotics in their diet, that they feel more depressed, more anxious, and they have low motivation and low energy. And they found out that it's not the medication that they're lacking, but it's the diet and lifestyle that needs to be treated. So there's a strong correlation about food and nutrition, hydration with our mental health. So that's something that we need to look at. And I know that fiber, high protein, and also Mediterranean diet has been studied to combat those barrier that we're facing, that if we're not getting those enough protein, then our mental health could also be at stake.
And also you mentioned lifestyle, and I think another key piece that you need to foster as a leader is finding your community. So in my case, I am a founding board member for Philippine Nurses Association in Emerald City with Dr. Mila Sprouse and Dr. John Levine. So finding your community and finding these pockets of people who will support you. So I'm also an ambassador for DNPs of Color as well for with Dr. McKamey. So by finding your community, finding your mentors, and fostering an ecosystem of support during your hardest times will really empower you to elevate your practice when things get hard.
Right? And those great organizations, PNAA, the NPs of Color, will actually make your network strong and make sure to bring you to the next level. So we highly suggest that you guys get involved and as nurses show up with those organizations. And
Yes.
thank you for emphasizing the importance of nursing camaraderie and nursing collaboration. Now, do you think men in healthcare, especially leaders like you, are facing struggles with imposter syndrome too?
I think it's imposter syndrome is real, especially when you start getting promoted, and when what you will find is as you move up the chain, not a lot of people look like you. So you really need to really believe in yourself, but also prepare. So when you're trying to find when you're in the process of advancing your career, whether to a director or maybe your first manager role, aside from your desire to be a leader, ask yourself, why do you want to be a leader? What are the gaps in my skill set? Do I know about finance? Do I know about quality improvement and throughput? And once you've identified those gaps, how will I fill those gaps? Should I take CEU classes? Do I need to find a mentor? So by being intentional in your career, that's how you can overcome imposter syndrome.
Thank you. And sometimes we have that, right? I could not do the job. Am I fit? How do I do this job at the best of my ability? So those are the back end questions that we have, and we tend to sabotage ourselves. So always believe in yourself too. And I
Yeah,
like
and give them the if you don't try, the default answer is no. So you might as well try. So for me, what the things that I regret are the things that I didn't attempt. So always just jump in and see where it goes.
I can sense about your capability to have the power of confidence with humility, and at the same time, being able to do it. Like as they said, like Nike, just do it, just try. If you never try, you never know, as they say.
Yes, yes.
Now, what advice would you give to men in healthcare who feel pressure to always stay strong? And how can we create spaces where men feel safe talking about their mental health without shame and being stigmatized?
I think it's really important, whether it's in your unit or in your leadership team, to establish psychological safety. So whenever I would have these very difficult meetings or we're in a crisis, I would tell them that, remember, this is like Vegas. Whatever we talk about in this room stays in this room. So enabling that psychological safety, but protecting their trust as well. So when you hear something, make sure to treat that information with utmost confidentiality, because it takes years to establish that trust, but it only takes one moment to destroy it. And I'm sure we've all been in those meetings wherein you thought you were in a safe space and then it's weaponized against you. So you need to be very cognizant of the people you can trust. So the only advice I can give you is to find your circle. And in Harborview Medical Center, I actually found my circle with lifelong friends. One was a leader in ICU, one was the leader for APPs, and we actually have I'll mention them, like Jay Sandel, Melvin Tam, Kelly Ponanen. We were all in this together, and when we spoke about issues, we could actually just let it all out unfiltered, and we had that circle of trust, and we ended up it not only bonded us, but we became lifelong friends as well in the process. So by fostering that, by finding that circle of trust, that is almost mission critical, because otherwise you will go insane in leadership. It because there are days where everything anything that can go wrong will go wrong. So by finding your protected circle, you're able to decompress and reflect.
Yes, I think trust is the basic foundation of every relationship. We always emphasize on like building a therapeutic alliance between our coworkers and also healthcare leaders like you. We really need to make sure you set a example that the staff will feel safe and the staff will feel supported. Remember, there's always a saying that nurses leave the bedside not because of their work, but because they don't like the administration or the how
Mhm,
the leadership runs, and
mhm.
that's basically gonna cause some problems later on with you being the leader and leaving all the staff. Then you're not creating a solid core team and the patients suffer. Short staffing comes in and nurses hop into different jobs and nothing gets done. So you eventually step into healthcare innovation, not by leaving nursing behind, but by expanding its impact. What inspired you for co-creation of Carexa?
Yes, what inspired me to create Carexa were my experiences as a nurse. Because, as I've said, it's called vital for a reason. Vital signs is the most critical metric for you to determine if a patient is going downhill. And Carexa is a remote patient monitoring company that decreases the level of effort for patients to connect their vital signs machines to the healthcare provider and EHR. So typically, patients have to connect to an app or find Wi-Fi to connect their vital signs machines. But for Carexa, I'll show you what the technology that we've developed is. The only thing they need to do is to actually plug in this gateway. And once they plug in this gateway, they just take their vital signs as usual. So, for example, this is a pulse oximeter. And once they get the vital signs, everything is color coded as well. So, as you can see here, once I get the vital signs, I just remove it and this clicks, as you can see, and that means that it's auto populated in the EHR of the provider. What How does this improve the provider's workflow? One, they're able to get notified when the vital signs is not within normal limits. But the power of this as well, it enables early intervention. So, for example, instead of a patient going to the ED, maybe they can provide a cardiology consult if the blood pressure is elevated. So that is how we've operationalized remote patient monitoring. And we also leverage the power of AI to decrease the level of effort for staff. And the inspiration behind this was actually, for me, the inspiration behind this is my mom, because, as you know, with patients getting older, suddenly I would hear she's hospitalized in the Philippines, and it's very heart-wrenching when you don't have any situational awareness. Oh, I think my blood pressure is elevated. But the beauty of Carexa is that we also have a patient caregiver app that provides full transparency on the vital signs of their loved one. And an interesting comment that we've heard from a patient's family member was that what they found is that by joining Carexa, her mom and dad are actually more compliant to taking their blood pressure every morning, knowing that the provider has full visibility on the vital signs of her parents. So that's something that I was very surprised by. And I'm a co-founder of this company with my classmate from MIT, Dr. BK Nayak, who was my classmate during my MBA program. So both of us are very mission driven, and both of us have aging parents as well. So that is our why behind building Carexa.
And this Carexa will definitely answer those healthcare problems that we're facing, right? Hospitalizations,
Mm.
delayed in treatment, which is great. And from the term itself, Carexa, who formulated this name?
It was formulated by us as co-founders. It stands for Care Extended by Intelligence.
Nice. Okay. I really love it. Like caring extra mile, right? So something
Yes.
like that, and very innovative. And is this covered by insurance? How can they get a hold of you in case that they're interested of doing this Carexa?
Yes, feel free to add me on LinkedIn or email me at joseph@carexa.ai. And yeah, I'm very active on LinkedIn. So you just DM me and I'll connect. And the beauty of what fills my cup the most is we actually partnered with a Filipino American clinic in the heart of Carson. And what I found with led by Dr. Jenny Batong Malaki, and what I found was that the it truly fills my cup by creating innovation, but by serving your community as well. So they would invite me to these community events, and I would actually teach the patients about the technology, and it was so inspiring to me to see patients of varying ages and comfort with technology that for them it just made sense, and they truly appreciate the partnership with Carexa.
Amazing. And did you know that Dr. Batong Malaki and some of my friends are precepted with her? This is
Oh, you
amazing.
know her. Okay, yeah. She's a legend. She's a legend.
Yeah,
She's a legend.
just
Shout out to
famous here
Dr.
in Japan.
Jenny and Vanji
Woohoo.
and her staff.
Yes. Now, for nurses interested in transitioning into tech, basing from your journey, where should they start and how can they succeed on this?
I think it all starts at the unit level. There are simple ways to get involved with technology and leadership. And in my case, I was the chair of a unit practice council. So I think for nurses, just raise your hand and be involved. So the beauty of being involved in shared governance is that you will work on projects at the unit that has department level implications, whether it's the rollout of Epic, changing a simple nursing note, or even implementing new technologies such as vital signs machines or EKGs. It will enable you to see how technology is implemented at the nurse level, because at the end you are, aside from the technology, it's also the buy-in of the staff that is actually more important. What's the use of technology if no one's using it, right? So for me, be raising your hand, try to be a chair or co-chair of the unit practice council. It all begins there.
Yes, and I think that's an initial step. Just get into it and show up and make
Mm,
sure that we use technology for
mm,
our advantage. And
mm.
that's basically to improve the patient healthcare outcomes too. And for you and your tech and nursing perspective, how do you see AI actually changing the day-to-day work of nurses in the next 5 to 10 years, and how responsible nurses should be in the usage of AI?
I think it will never, ever replace nurses. It doesn't have the heart, it doesn't have the empathy. That being said, it will supplement our nursing practice. So how I think about AI is it will give us superpowers as nurses. So instead of doing a lot of the repetitive tasks, it will enable us to maximize our scale of impact as nurses. That being said, we really need to be at the forefront as nurses in the implementation of artificial intelligence. We can't sit at the sidelines, because I'm sure we've all been there, wherein a project or our initiative was just thrown upon us as frontline nurses. And how do we combat that? By being involved, speak up. So I highly implore nurses to really partake in that conversation, even when your hospital is just in the process of vetting a vendor or determining which solution to get. Make sure you're at the table, because if you're not there, it is almost a disservice not only to our profession but to patients as well.
Thank you. And I strongly believe that AI will be used at our advantage. And I agree with you. These are our superpowers or our accessories that we can use to make us more efficient and effective at the bedside and not experiencing burnout. Because a lot of us are leaving the bedside and even different healthcare settings because of burnout. So it's real and perceived. And I think AI is here to stay to solve that or fill in that gaps of burnout syndrome. Now, Dr. De Veyra, such a great work that you have, and you are a first generation immigrant, someone who left the Philippines and built a life in healthcare, leading through crisis, and is now shaping the future of the system and always thinking outside of the box. When you look back at your entire journey, what would you want your younger self to hear today?
I think one of the key things is don't rush too much, right? When I remember when I was participating in a Code Blue, and I was running towards that patient, and then one of the more senior nurses told me, "Why are you running?" She asked, and then so she was saying that if you run to that Code Blue, you might fall, you might trip. So she said, "Don't hurry. Be quick, but don't hurry." So that really stayed with me, because at the end of the day, you the only way you'll be an effective leader and practitioner is by being cool, calm, and collected. So it's important. It's very imperative for you to, whatever you're doing in life, or you're making a career shift or transition, don't hurry. Make sure you're able to compose yourself, reflect, because a lot of these decisions we make can have long term implications to not only our professional lives but our families as well. So don't rush, relax, and just let it flow.
That's amazing. And you were able to emphasize about taking it slow and enjoying the process, right? Because sometimes we're in a hurry and we're comparing our timelines. Oh, he did that. Oh, I think I'm left behind. But I think there's always a timeline for everyone. And be kind to yourself. And
Yes.
I think there will come a time that you will shine on your own journey and not just comparing what you have. And whatever we see sometimes with our people, or we tend to compare our journey, and always remember that we are running a unique journey of our own. And if we always compare ourselves to somebody, then we're just aggravating our insecurity, and that can cause more anxiety and depression for us. So we need to make sure that we enjoy and take it slow, and make sure that you know where you're heading, and you know that you are the best version of yourself. Dr. De
Agreed.
Veyra, thank you for such a meaningful conversation, not just about your leadership and your innovation, but also about your identity, being a Filipino immigrant, and your resilience and humanity. If there's one thing I hope listeners take away from this, is that growth doesn't always mean leaving who you were behind. It can mean expanding who you are becoming. Like you, I've seen like a metamorphosis, starting from the bottom of healthcare and then going up. And there's indeed a place for elevation of our profession. And during Men's Mental Health Awareness Month, may this also be a reminder that strength and resilience are not the same thing, and that even leaders need space to be human. And to everyone listening, thank you for joining us for Mindful Moments. Please connect with Dr. Joseph de Veyra. Dr. Joseph de Veyra, where can they find you again? LinkedIn and other social media platforms that you have?
Yes, add me on LinkedIn, Joseph de Veyra, IG Joe de Veyra, and feel free to just email me, joseph@carexa.ai. I am at your service.
Thank you for your representation, and thank you for your visibility. Until next time, and take care of yourselves and take care of each other. We're rooting for you and your mental health, and thank you for making it as a priority. We'll see you next time. Thank you. Bye-bye.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.